Well, we're back right here in the studio, and I hope everyone out there is having a great evening wherever you may be watching tonight's episode. We have with us our first guest tonight. We have with us Dr. Oliver Witard, and Dr. Oliver is a senior lecturer in exercise metabolism and nutrition at King's College London. Doctor, welcome to our program, Hala Kuwait.
Thank you, Tariq. It's great to be here. Thank you.
Pleasure to have you with us, and welcome also to the state of Kuwait. Is this your first visit to the country?
It is. It's my first visit. It's been a fantastic 4 days in total that I'll be here.
How's it going so far?
Really well. The Gulf Sports Nutrition Conference has been a real success, I believe. We've had over 180 delegates attend the conference, and I think we're putting across some interesting, insightful information. So
good to hear that. I'm glad that you're having a pleasant and good stay right here in the state of Kuwait. And tell us now, you're here in Kuwait participating in the Gulf Sports Nutrition Conference at Dasman Diabetes Institute, and you said about 180 people or so attendees. Tell us, how is it going so far the first 2 days?
Yeah, it's been excellent. The engagement from the delegates, who my understanding are from clinical nutrition primarily backgrounds, but also from an exercise and sport nutrition background as well. We've been very impressed with the knowledge base of the delegates here in Kuwait, not only in clinical nutrition, but also in sports nutrition as well. So yeah, it's been a really fun time, not only giving some of the information, putting the information across, but engaging and asking lots of questions about
Yeah, I saw there's a lot of Q&As going on. People are very interested to seek the knowledge.
To seek the knowledge, and also they've been excellent in terms of answering questions really well, getting correct answers, and the knowledge base is certainly there, and that's not surprising. Dasman Diabetes Institute is a world-renowned institute. The facilities are phenomenal, and with the Sports Nutrition Conference, of course, we're very much keen in highlighting the importance of exercise, and the facilities at Dasman Diabetes Institute are phenomenal in that sense. They've got this enormous resistance training suite up on the top floor, which has a 100-meter walking track going around. So, and then lots of resistance exercise training kit, and then also little breakout rooms where lots of fitness and exercise classes take place. So, and that goes across the lifespan. So within the gym at the moment, there were older adults, there were younger adults, there were coaches, there were trainers. It was just a brilliant environment to be part of.
Well, we're very happy that you've been having a very positive time right here in the state of Kuwait, as well as at Dasman Diabetes Institute, where the conference is being held. I know yesterday you had 2 interesting presentations. Maybe you could tell our audience a little bit about that, sir.
Yeah, sure, Tariq. So the first session was around carbohydrate, all things carbohydrate. And what my talk was about is in the context of endurance sport performance. So we were talking about how much carbohydrate was required before exercise, before you go out onto that starting line to run, say, a marathon, for example. And then I also talked about how much carbohydrate is required after the race to try and recover from the race. And then I finished up with a case study. The sub 2 hour marathon with Eliud Kipchoge. So it was a big event, a big Nike sponsored event a few years back. And so I walked through what kind of carbohydrate nutrition Eliud Kipchoge would have consumed during that race, that sub 2 hour attempt.
Great to hear that. And I know coming up tomorrow, the final day of the conference, you also have a presentation. I believe this is more, I think your forte is going to be your tomorrow. This is the one we talked about earlier before we came in for the interview. Tell us what you have lined up for the people in attendance tomorrow at the conference.
Yes, so tomorrow we're primarily going to be talking about protein nutrition and muscle.
Tell us more about that, please, sir.
Yeah, so talk about how much protein we require to maximize muscle growth in the context of resistance trained athletes, but also in the terms of maintaining muscle mass with advancing age. As we get older, an inevitable aspect of aging is muscle loss, unfortunately. So what we are interested in at King's College London and beyond is how we can optimize protein nutrition to try and help older adults maintain muscle mass into later life, and as a result lead more independent lifestyles.
So what does that mean exactly, Doctor? Tell us a little bit more about that. The protein intake should be higher? Is that, can you elaborate more?
Yep, you're on it, Tariq. That's the main point, in that as we age, our muscles essentially become less responsive to ingested protein and also exercise. And this is a term that we use as anabolic resistance, or muscle anabolic resistance. So the idea is that as your muscles become more resistant, you need more protein to try and stimulate that muscle to respond to either exercise or protein feeding. And I know off air we were talking a little bit about exercise, the importance of exercise, and of course the importance of exercise or moving, just being physically active. These are all activities or stimuli that ensure that the muscle remains responsive to diet and nutrition and food, i.e. protein foods.
And helps prevent diabetes also, or even if you have diabetes, helps you maintain it better.
Absolutely, and it's not only, the message isn't only around asking individuals to move more, to exercise, to participate in physical activity. It's also about trying to discourage individuals from being sedentary. So like we are, unfortunately, at the moment, we're seated. Can we get people to start thinking about standing, walking around more, having breaks within the workplace?
Yeah, like maybe using the stairs instead of the elevators, correct?
Exactly, using the stairs instead of the elevators. Maybe just taking little 5-minute walks, just to break up the day, these little snacks of physical activity. And from a metabolic standpoint, in terms of blood glucose control, that's really important, and has been shown that just those mini breaks can have a profound effect in terms of maintaining our blood glucose levels, and as a result reducing risk of diabetes and
any chronic conditions with it.
Exactly, any kind of metabolic diseases. And the thing with exercise and metabolic diseases, they're all linked. So, and I think the Dasman Institute is again leading the way in some of this research.
And you came at the right time right here in the state of Kuwait, Doc. It's so beautiful. The weather outside is nice to enjoy all the outdoor activities.
Absolutely. So I think it's about 25 degrees, something like that. So we managed to get a nice run along the coast, about a 10K. So
that's good to hear. Good to hear. Nice to enjoy the outdoor activities right here in the state of Kuwait. And go ahead, sir. You wanted to add something?
There were plenty other people running along the promenade as well. We saw plenty of other runners.
Excellent.
So that was really nice.
Yeah, I know at Dasman Diabetes Institute they always encourage all the the patients as well as people who come for conferences, lectures, whatever it may be, to always move and get out and exercise and try your best in that.
And the gymnasium, something else I should have said is that the views are incredible. You're exercising, you're on the treadmill, or you're lifting some weights.
Beautiful view of the Gulf.
You've got a whole view of the Gulf, and kind of say that as a joke, but also that's really important. The environment that you're in is incredibly important from a physical activity perspective, because back in the UK, especially if it's a rainy, cold winter's day, it's much more difficult to get out and exercise.
You feel down when it's a little dreary in that. So.
Absolutely. And of course in the summer months, I appreciate that they're quite harsh from a temperature perspective. And if you've got a resistance training or an exercise training room like you have at the Dasman Diabetes Institute, that's brilliant, because obviously air conditioned, and it's a place where you want to go to exercise, and even have the walking 100-meter track as well, where in between maybe lifting a few weights, you can go in your rest and have an active rest. So yeah, I think it's a great setup, and the coaches, the trainers are incredibly helpful and pleasant. And I know one of my colleagues from the UK comes over regularly from the University of Glasgow, Professor Stuart Gray, and helps set up some of these exercise training plus nutrition research projects. So I think Dasman Diabetes Institute is collaborating with some excellent researchers within the field of exercise and nutrition.
Well, we're very happy, Dr. Witard, that you and your colleagues are having a good time right here in the state of Kuwait, and we wish you all the best of luck tomorrow in your presentation. And as we're winding up today's interview, do you have any last comments or words for the audience watching Hala Kuwait tonight?
Well, thank you so much for making us feel so welcome during our time in Kuwait. Like I said, this has been my first trip to Kuwait, and I'd love to come back.
Hopefully
again.
the first of many.
Oh, I hope so. And the food, incredible food. Loved the food so much.
That's great. Well, we're very happy that you're here with us. We know you have a busy schedule. We appreciate your time with us tonight right here on Hala Kuwait. Thank you for coming, sir.
Thanks, Tariq.
Thank you very much. We'd like to thank our distinguished guest, Dr. Oliver Witard, for his time with us. He's a senior lecturer in exercise metabolism and nutrition at King's College in London. Thank him very much for his time.